Many patients are interested in Botox today. In fact, it's the commonest non-surgical treatment that we use in the face for aesthetic improvement. Even though everybody hears about it, many people have questions about what's it really like to have Botox. When we do Botox, we first of all meet with you in the office and determine what your concerns are and if you're a candidate. If so, we can proceed that very day to inject some Botox. We use a very fine little needle, and most people find that it's not very painful at all. Some say they hardly feel it at all, and if one does feel a little bit of pain or discomfort, usually it's graded on a scale of about 1 or 2 out of 10. Very minimal. Right after one gets Botox, you can put some makeup on, you can go back to work, and do whatever you would normally do in that day. One of the downsides is that occasionally a person may get a little bruise. Not commonly, but certainly not uncommonly either. And so we put pressure on in the office to help prevent that. We also sometimes give patients some arnica montana, which is a homeopathic medication to diminish it. And if you are going to have some Botox, it's good to stop any medications that might increase bleeding. Things such as aspirins and non-steroidal drugs or anti-inflammatory drugs. Now once you have the Botox injection, it doesn't work right away. We have you do some muscle actions to help the uptake of the Botox. We think this makes it last a little longer and work a little better. Most patients will notice an effect with the muscle action diminishing over about 3 to 5 days. And then the Botox will last about 3 to 4 months for most patients. At that time, if you like the effect, you can have another injection. If you wish to put it off longer, that's okay too, but you can expect that the muscle action will come back. If your main goal is to diminish the wrinkles, then they won't all be gone in 5 days or so when the Botox works, but depending upon the depth of the wrinkles, it may take several weeks or even a few months for the wrinkles to gradually efface and become better. Sometimes, of course, we encourage that result by putting a little bit of filler in as well. The main downside that we can see with Botox is an unintended effect, and so we don't want to use too much, which gives you that so-called frozen look. So we start with a very low dose and work it up to the dose that works just right for you to give you a totally untreated look, but just a softer, less angry, less tired, and more youthful look. And this is a very possible thing to do. Rarely a patient may get a little bit drooping of an eyelid, or you could have trouble with P's and B's if you had too much Botox in a given place. But these are unusual and doesn't mean that you would not be able to have Botox again and have no impact at all. So Botox, all in all, is a very simple and very effective procedure to give you a nice rejuvenation without any surgery.